easing of restrictions doesn't come without health risks on both sides of the argument. So our chief health editor, Dr. Partha Nandi, joins me now. Doctor, good evening to you.
Good evening, Dave. How are you?
Good, good. What do people need to know to stay safe if they plan to come inside and enjoy a meal in a restaurant?
A really important question, Dave. So there are several things that you can do. First of all, you don't want to go to a restaurant when it's busy and full of people, right? So I'd call ahead and ask before making plans. And when you have them on the phone, ask this: are the tables 6 feet apart? Do the servers and cooks wear masks? And an important question: how well ventilated the restaurant is. If it's not well ventilated, then airborne transmission can occur even if you're 6 feet apart. Now, before you walk into the restaurant, make sure you're wearing your mask, right? You need to do that, and only take it off when it's time to eat. I've seen people keep it off the entire time. Make sure you just take it off when you're trying to eat. And now, as the weather is starting to warm up, you can also consider outdoor dining better than indoor dining and safer. And you want to follow precautions. Sitting too close still means you could get exposed to the virus from folks at another table.
So the health pros and cons then of easing restrictions for the industry.
It's really a tough question, right? So I think the pros and cons really depend on where you're sitting at, but meaning on which side of the argument you're on. But to me, here's what I think the pros are: more jobs, right? Which means more money, which means people can have stress levels that decrease, and they can also get better health coverage. A recent study showed 30,000 Americans died because of unemployment and lack of health coverage. So it's important. Another pro is improved mental health. People can get together and socialize more. I mean, so many of my patients complain about that. And also, people who are unemployed in the healthcare industry, not the healthcare industry, but the hospitality industry rather, it helps them mentally by giving them purpose, by getting back to work. Now, what about the cons, right? Here's what's not so good, because we know that eating out can increase case numbers, eventually lead to hospitalizations and death rates. And past experiences have shown this, and this is important to understand. If you lift restriction too soon, it can lead to another wave of infections. Really important to understand that. And now we have variants, right? We don't have just the original coronavirus 19, but we have variants. And evidence suggests that the variants first found in the UK, which is called B117, 43 to 90% higher reproduction rate, which means that it can infect you quicker. So we could get infected much more. So very concerning. I think you put the pros and cons together, and let's listen to our state officials. They're looking at this every single day, and if they can open up safely, they will. But let's not go hog wild and say not the case numbers have decreased. Let's remember 60,000 cases still, right, every day. It's not like it's over, and you want to be able to get it down below 10,000 cases. I agree with Dr. Fauci. So I think we got a little bit more to go. I think if we have a little patience, we can get there safely.
Well, and as we mentioned, some people comfortable, some not. This is the first time I've been inside a restaurant at lunch or dinner time, except for takeout, since the pandemic began. So that's one indication. Dr. Nandi, we thank you for your advice and expert view on things here tonight.